Hi, I have a question for you. When you are down with a fever or a headache or a body ache, have you felt plain paracetamol is not good enough? Or you have heard it doesn't work at all? If you are someone who believes strongly that plain paracetamol never works, you really need to watch this video and get your facts right about paracetamol today. Hello, I'm Dr. Jyoti Puthran, physician who started low-cost clinic at Banshankari, Bangalore to provide rational and affordable medical care. For more details on low-cost clinic, kindly check the link in description box. It is one of the most common misunderstandings that paracetamol is not as effective as any other medications that are available in the market for fever, aches and pain. Now, let me give you a real life example. I had a young man, Mr. P, who came to me with headache, saying he hasn't had relief even after taking paracetamol for 2 days. When I asked how many tablets he had taken, he said he has been taking a 500 milligram paracetamol once in the morning and once in the evening with no relief at all. When I checked his weight, he weighed about 66 kilos. Do you think paracetamol was not working for him and he really needed a combination painkiller medicine? Now, here is an important thing to understand. The main reason for paracetamol not providing relief from symptoms is patients often taking a lesser dose than is required as per their body weight. The optimal dose of paracetamol for both children and adults is 10 to 15 milligram per kilo of body weight, with 1 gram being the maximum as a single dose for adults. Now, according to this, our Mr. P, who weighed 66 kilos, instead of the 500 milligram that he was taking, actually needed a minimum of 660 milligram to a maximum of 990 milligram of paracetamol per dose. An easier way out in such situations would be to take a 1.5 tablet of 650 milligram of paracetamol, which is easily available in the market. So, if you're correctly understanding, a 50 kilo person needs up to 750 milligram of paracetamol, and a person weighing 70 kilos or more needs 1 gram of paracetamol per dose. Second important thing that you should remember is that the duration of action of paracetamol is just 6 hours. This dose needs to be repeated every 6 hours if there are symptoms of fever or pain coming back. If symptoms return after 6 hours of taking a paracetamol, as was the case with our Mr. P, it usually means the effect has worn off and not that the medicine has failed. It is important to note that the maximum dose of paracetamol per day that can be taken by any adult weighing 70 kilos or more is 4 gram of paracetamol, that is 1 gram every 6 hours, 4 times a day, which is why it is important to know the content of other medicines that you are taking along with the paracetamol, especially some medicines for cold that would also have paracetamol in them. This is very important to prevent an accidental overdosing of paracetamol. Also, it helps to remember that almost all kinds of mild to moderate pain, except for very severe pain due to fracture or kidney stones, respond very well to paracetamol. Now, you may ask me, why is it important for us to know that paracetamol is very effective as a fever and painkiller medicine when so many other combination painkillers are available easily as over the counter drugs? Two important reasons. One, financial, and second, medical. The financial reason being, paracetamol comes at just 1 to 5 rupees per tablet as compared to 5 to 30 rupees per tablet of other combination medications. So, paracetamol is highly cost effective. The medical reason being that paracetamol is one of the safest medications that we know, given to even babies, and is safe in almost all conditions, except in cases of pre or coexisting liver disease. Meaning, if you have a liver problem, you need to be careful when using paracetamol. It does not carry the same risk of gastritis, peptic ulcer, or kidney injury that many other over the counter combination painkiller medications do. So, if need be, it can be very safely taken even on an empty stomach, unlike other medications, which is strictly advised to be taken only after food. Also, in cases of dehydration, which is very common when someone has fever or loose motions or vomiting, paracetamol doesn't cause any damage to kidneys, which is a major risk with other medications. Next time you have fever or body ache, check if you're taking the right dose of paracetamol before assuming it doesn't work. Share this with someone who always reaches out for stronger painkillers. Take care, stay informed, and stay healthy.